I had a specific research question as a sophomore that had to do with chronic illness and spirituality, and I began the research here in Philadelphia with the summer program, but I hadn't decided that I was going to go into health services research of any kind, and I really didn't know what I would be getting into if I did. And the summer program really gave me that first experience of being a researcher, being out in the field, collecting data, analyzing data, and kind of living that life and understanding really what would be involved if I did choose this path. For me, it was a life-altering experience because just the mentorship of the program was extremely valuable. I had a wonderful mentor, Dr. Canusio. I also had mentorship from other faculty while I was here at Penn and at Wharton. And I really had the chance to kind of try out some of these research strategies and creative methodologies that I'm really interested in now. I'm in my 5th year. I'm beginning my dissertation work, and my research looks at the meanings that religion creates and the experience of chronic illness for religious Black American women. So I've interviewed women in the Bay Area, throughout the San Francisco Bay Area, and I actually use a methodology that I learned here from Dr. Canusio in my work at through the summer program, which is photo voice and photo elicitation interviews, which involves giving participants cameras and asking them questions related to the photographs they take in the interview. A lot of my findings relate to, first of all, religious institutions, so churches and the ways that those can be empowering spaces for women in times of illness and in other times, but also the ways that they somehow limit their choices or encourage them to make choices that value the needs of others over their own. I think faith is kind of an orientation towards hope that carries women through a lot of these situations and affects their health behavior choices as well. Well, one thing I really think is important is understanding patient experiences of care. So in this case, chronic care, I think doesn't necessarily consider the systems of meaning or belief that people are engaging as they make decisions about their health and their behaviors on a day-to-day basis. So I think in terms of understanding the meaning that an illness has in someone's life, you really have to speak to people directly, and I think that's what I'm trying to do through these interviews, is understand better how women understand their illness and how they're choosing to respond to it based on systems of cultural meaning, systems of religious meaning, and other influences that their community may have in their lives. I think for clinicians, it's really important to understand how patients are understanding care and illness in order to better support them in the process of seeking and being retained in care. I definitely hope to be able to continue this kind of research, but I really hope to be able to bridge, beyond health services communities and reach out to various other nonprofit organizations that are doing similar work. Right now I work in the HIV ward of San Francisco General Hospital, which is a public hospital, interviewing patients who were diagnosed with HIV through routine testing about the experience of getting into care. I'd like to continue doing work like that within hospital settings and also within academic settings, the kind of research I'm doing now. We're gathering data about people's lives. We want to understand what people are living with, and the only way to do it is to talk to people. And I believe in participant-led research in which the participants are able to kind of represent themselves and define the concerns that are important to them. And those will direct the concerns of the research community. And while that is kind of a flip on the traditional model in which the researcher defines what's important and pursues their research according to their own agenda, I really think the balance of power is more desirable when you have participants shaping the research that affects their own lives. I'm the first African American woman in my program ever, and I feel that my program doesn't always know how to support me in the ways that I need, and SUMR really did. I really felt that they were sensitive to my specific concerns, the concerns of my research, which is among African American women. And given that we are so underrepresented in grad schools and in academic careers generally, it's really important to me that this kind of program exists to support students at the beginning of that process. I I just know there's a lot of resistance once you start down that path. And I think the more support you have, the better. And it's a great place to start building your team, finding people who are doing work that you really respect, having their support in your own work, and begin feeling out kind of what your path is going to be and where you want it to take you.